Maria, a 62-year-old female, underwent a total knee replacement 24 hours ago. She has a history of hypertension and atrial fibrillation, and her surgery went well. Post-operatively, Maria is receiving enoxaparin subcutaneously as prophylaxis for venous thromboembolism. You are the nurse assigned to care for her on the second day post-surgery. Her vital signs are blood pressure 135/85, heart rate 98, respirations 18, temperature is 98.9, and O2 saturation is 98% on room air. Her hematocrit is 38%, platelet count is 120,000, and the APTT is 68 seconds. What potential complications could arise from Maria's anticoagulation therapy?
Hello, Maria.
Hello.
So some potential complications that could arise from your anticoagulant therapy is you could have a low platelet count. So your platelet count is already pretty low. It's at 120,000. So you are at an increased risk of hemorrhage. You could have a neurological injury due to laying on your back. You could have some spinal bruising. You might have some irritation around the injection site. And there is a risk of a pulmonary embolism. And if there's any blood in your urine or stool, or gum bleeding, or red spots on your skin, let your provider know. And you have high APTT, which means your blood takes longer to clot.
Okay.
What signs and symptoms should you monitor for to detect bleeding or thrombocytopenia?
So signs and symptoms for you to monitor for are going to be red spots on your skin, any excessive bruising that seems out of the ordinary, any blood in your urine or stool, and any gum bleeding or a bloody nose that doesn't stop.
Okay.
What lab values will you need to monitor for safe anticoagulation management?
So the lab values we're going to run on you to monitor you is going to be APTT, which is going to show your clotting time. We're going to do a complete blood count, and we're going to do a specific PTT because you are at risk for DVT and excessive bleeding.
Okay,
Okay.
identify your interventions you would implement and how you would assess for indications like bleeding or neurological injury from a hematoma. Go.
Okay, so you are at risk for DVT. Some reasons why you're at risk is because you're not moving very much since your knee surgery. So some steps to take is I'm going to go ahead and call the doctor and give an order for an ultrasound so we can make sure you don't have a blood clot or a pulmonary embolism.
And the DVT is a blood clot?
Yeah, it's like a deep vein thrombosis, so it could be a blood clot in your leg.
Okay.
And then we might put some STD pumps on you, which are like kind of like a little thing that wraps around your legs and provides pressure.
Okay.
So that can help with that as well. You want to elevate the affected leg that's hurting you. And if you have any shortness of breath or anything, let us know because that could be a possible pulmonary embolism.
Okay.
A few hours into your shift, Maria reports pain and swelling in her left calf. She appears anxious, stating she feels short of breath. What is your immediate nursing assessment based on these symptoms?
So my immediate nursing assessment is I'm going to advise your doctor to stop heparin because since your blood count is already low, we don't want to keep giving you heparin and make it lower. And then I'm going to advise your doctor to administer a non-heparin anticoagulant.
Okay.
And we can give you some protamine, and we'll give that through an IV slowly as your doctor prescribes, and we won't exceed 50 milligrams in a 10-minute period.
What does protein does for what's that do for her?
It's gonna help.
Wait.
It's gonna help. It's gonna help prohibit the blood from clotting.
Oh, okay.
So it's just gonna help her stay healthy and feeling good.
Well, thank you.
Hi Maria. So it looks like you're at risk for DVT, which is going to be a deep vein thrombosis, a possible clot in your leg. So the reason why you might be having this is because you haven't had a lot of movement since your knee surgery.
Okay.
So the steps I'm going to take is I'm going to call your doctor and I'm going to ask him to do an ultrasound on you to make sure because I know you have some shortness of breath too.
Yeah.
To make sure you don't have like a pulmonary embolism or anything kind of crazy like that going on. And we might put some SCD pumps on you, which are going to apply pressure to your legs. If you'll elevate the leg that's hurting you. And then we're going to continue the drug, and I'll let your provider know, and we'll do another CBC count and another APTT count.
Okay.
And then the next steps are going to be, I'm going to advise you to stop heparin, but we're going to wait on your doctor's order to see if he approves that because your blood count is lower than 100,000. And we're going to administer a non-heparin anticoagulant, and we're going to administer protamine through an IV slowly as prescribed, and we won't exceed 50 milligrams in a 10-minute period.
Maria's condition stabilizes and her physician orders her discharge with instructions to continue the medication injections at home.
So great you're going home today. I know you're
Oh,
ready for
good.
that.
Yes, I am.
Okay, so whenever you go home, just make sure you report any bruising. You report any little red spots on your skin, otherwise known as petachia. And then definitely report any hematoma, which is going to be like blood pooling under your skin. That can be a sign of internal bleeding.
Okay.
And then any black tarry stools. And then just report any calf pain, any tenderness, swelling, or any breath shortness.
Okay.
And then as for lifestyle changes, just from now on, avoid NSAIDs. So that's going to be like your aspirin, your ibuprofen. Avoid sharp objects. And then avoid any risky activities. Elevate your legs as often as possible and get frequent checkups. And make sure you monitor your sensation and movement of your lower legs to make sure that everything's comfortable and normal.
Okay. All right. Thank you.